Hello, and welcome to Midcoast Morning. I'm your host, Mick Sweetman.
And I'm your co-host, Jesse Woodward.
Today on the program, I speak with Carl Buttersworth about Vancouver Island University's new Seafood Innovation Station.
We then bring you the most up-to-date information about what is happening with COVID-19 on Vancouver Island, with a Q&A with Chief Medical Officer Dr. Richard Stanwick and Island Health's Vice President of Pandemic Planning, Victoria Schmid.
Logan Clifford, a woman of Chippewa descent, will talk with us why she's organizing a rally in Courtenay today to demand the government implement the 231 recommendations of the inquiry into missing and murdered Indigenous women and girls.
We will also hear from downtown Eastside blues legend Delannah Gail Bowen about her new single, A Lullaby for Missing and Murdered Women, in conversation with David P. Ball from co-op radio show The Pulse in Vancouver. But first, Mick's interview with Carl Buttersworth.
We're joined by Carl Butterworth, manager of Vancouver Island University's Deep Bay Marine Field Station. Thank you for joining us today.
Thank you very much for having me on. It's a pleasure to talk about this initiative.
Can you tell our listeners what a Seafood Innovation Center is?
The Seafood Innovation Center is something that VIU has been working on for 2 to 3 years at this point. And we went out to the seafood industry, which includes processors, the traditional fishery, aquaculture, and we asked them, is there a need for innovation within the seafood industry? And what we heard back from them was that they felt the industry hadn't really innovated in a large sense for the last 50 years, that many processes were a little quicker, but were still continuations of what had happened before. And they felt there was definitely a need for new technologies, new processes, new approaches to doing business, but also definitely a need for a group that could tackle applied research as it applies to seafood. So look at some of the bigger problems that are beyond the scope of any one company to tackle and really do it on behalf of the whole sector. And VIU has worked quite a bit with the Ministry of Agriculture, Food and Fisheries. And so we applied to their Food Hub program for funding to launch the Seafood Innovation Center, and the ministry very generously funded us, and that is why we get to talk today, and we are very excited about this initiative.
Okay. So this is kind of a case of the seafood industry in Vancouver Island maybe being a little bit behind the times and want to bring them basically into like a modern seafood industry. Is that correct?
To a certain extent, yeah. And wouldn't suggest that there hasn't been innovation within the industry. There's a lot of people doing some very interesting things from a value-added point of view. And also as an industry getting together and acting on different issues. But there's definitely a need to bring a bit more applied research to the industry, but also looking at some things that people who get into, when someone's an entrepreneur and they're getting into new business, there's some things they're very, very good at and other things where they're looking for more guidance, right? And so getting into a business where we can help seafood entrepreneurs understand the regulatory environment around seafood and make sure that they are compliant with all the different sides of the regulatory environment, where they can provide mentorship, business expertise, help to link them up with packaging, get them exposure to the seafood value chain so they can get their product out there quicker and more effectively, and provide a whole suite of services, things that you'd expect from a university too, like training and education and that sort of stuff.
Right. Just on that, like how will students be involved in this? Like, are they going to be doing like placements and practicums at the center?
Yes, we would see involvement from our culinary students in being part of this process and learning from the entrepreneurs, helping the entrepreneurs who are going through the program. See room for our business students getting into marketing, public relations, market analysis, surveys, marketing surveys, just around the seafood industry and how to increase the domestic consumption of seafood, also the consumption outside BC of seafood. We can see interactions for our sciences students in biology, fisheries and aquaculture, resource management, in terms of applied research projects that they would get to be part of. So they're part of actual research going forward. And probably other tie-ins that we're not even thinking of right now in the social sciences when we look at perceptions around seafood, things like that. So that there will be a lot of opportunities for students to be engaged in these things.
Right. Just on the research part, is there anything that you're planning to research specifically right now?
It's interesting. We've been parts of this program we've already been working on for a number of years. So a great example is the work that we're doing with the shellfish aquaculture industry at the moment around oysters. So oysters, Pacific oysters that are produced in BC that many people have seen in grocery stores have been struggling in the environment, right? It's not unusual for an oyster farm in British Columbia to experience between 25% and sometimes up to 90% mortality in a single season just before oysters are about to go to harvest. And so one of our applied research projects has been a genetic selection process trying to breed lines of oysters that are hardier to environmental change, hardier to local diseases, grow at a known rate and are a bit easier to manage, and produce the kind of protein that we're looking for in this kind of product. So that's one example of a project that's a little bit bigger than any one business or even maybe the industry can tackle, where we can provide some value and really help out. And so we're hoping to develop more projects like that that are ones that will have a significant impact. Because if we can improve oyster mortality in the field by, say, 25%, that's millions of dollars for the industry. And if we can do better, the returns just go up.
And will you be working directly with any of the local restaurants or chefs? Is that an angle that you're looking at? Are people going to see the results of your work on their plate somewhere?
Absolutely. One of the key directives from the province is that they would like to see more BC seafood consumed within British Columbia. And that's both in BC institutions like hospitals and schools and places where, as a public sector, we're providing food, but also in BC restaurants and on, plates for consumers at home. And so one of the main focuses for this center will be really educating British Columbians on how do you prepare seafood. Many people get a little bit worried about seafood because they're not sure if they've prepared it correctly or if they've done a good job, even if they've overcooked it. And I think we've all done that with salmon, unfortunately. So it will definitely have a role in educating the public in a fun and friendly manner, in a bit of an entertainment education sort of program to get people to better understand BC seafood, but also to not just for individual consumers, but to help organizations understand how they can work it into an industrial size food operation, how they can better integrate that, how they can cook with seafood at scale as opposed to just individually at home in a kitchen. So there should be quite a large educational component around this.
Another aspect that you're looking at is not only economic development for the seafood industry at large, but specifically for First Nations economic development here on the island. Can you talk a little bit about that?
Absolutely. VIU is very committed to reconciliation and to doing anything that First Nations feel would be helpful to them in their journey. And every First Nation on the coast has coastline. They're looking for interesting economic development initiatives that will benefit them, their nation, their members, but also be economically and environmentally sustainable. And so we're hoping that through this center, we can develop economic development opportunities, new industries, new approaches to old industries that will make them more attractive to First Nations, and then be the people who can provide the information, provide the support, the training, the education to assist everybody, First Nations and businesses, to get into different sectors of the seafood economy that they might not have been in before. Okay.
And just to wrap this up, if you're a student at VIU, how would you get involved into this Food Innovation Center? How can you get your foot in the door here?
Well, we'll be working with everybody's professors to really outline the kinds of research and educational opportunities, the avenues for engagement, all the possible ways that they can get into that. And then for those students who have a passion for seafood, then we'll find ways to get them in there and help them out with this. But we're really excited about some of the undergraduate opportunities for this.
Okay, great. Is there anything else that you think is important that we mention before we go?
Yeah, it's one of the things with this center is this is a long-term initiative. So we're working with the Ministry of Agriculture, Food and Fisheries to get it up and running. But as it develops, this is something that we plan on continuing as a long-term initiative. So for listeners who are thinking about the seafood economy, thinking about the blue and the green economy around things like kelp and marine plants, around fish, around shellfish, who have an idea, whether it's a recipe or whether it's a part of the industry they want to get into, we will be here for the long haul. So this is something where even if it's not there front of mind right now, but it's in the back of your mind, look us up in the future because hopefully we'll be here to help you out.
Thank you so much for joining us today. You're listening to Midcoast Morning on CHLY. That was Carl Buttersworth speaking about Vancouver Island University's new Seafood Innovation Center. Over 100,000 people on Vancouver Island have now been immunized for COVID-19. This comes as new cases continue to rise in the province, with 908 reported yesterday, including 55 on Vancouver Island. Dr. Richard Stanwick, Chief Medical Health Officer for Island Health, spoke about passing that milestone in a Zoom call with reporters yesterday.
Because, in terms of actual number of cases, we've also hit a milestone in terms of that we've certainly gone over, a level that, and we did it in such a rapid period of time. If you actually look at our first 1,000 cases to the timing of our second 1,000 number of cases in the island, a much shorter interval, which again is worrisome. But at the same time, we now have a fantastic opportunity to blunt it, and we have been able to blunt it significantly in the most vulnerable population. Those 100,000 doses went into the arms of the people at most risk of the most dire consequences with COVID. But we really want to get up to the position where Dr. Penny Ballin has been, speaking to. Anybody who wants the vaccine should be able to have it in their arms by July 1st, that first dose. And so, that's what the excitement is. Canada Day, and maybe make it Vaccine Day.
It's clear that even though the case counts are higher than the mainland, COVID is still a danger on Vancouver Island. Dr. Stanwick says it's a race between the virus and the vaccine.
I think our most effective weapon still at this point in time that we need to deploy even further is to get as much vaccine into as many people's arms as possible. That's one of the best defenses. We also need to be able to look at what we are able to do in terms of identifying those individuals who are positive through our testing and then through the contact tracing methods to allow those people to be able to go into isolation. Those are very effective methods in terms of control. On top of that are, of course, the ones in which we have public health orders, and some of them are more effective than others. I think the other piece that has been acknowledged is the significant amount of COVID fatigue, where the anxiety is that, how many times can you actually put people into a lockdown situation? So and again, I leave it to the senior decision makers to try to find that balance between achieving public compliance and complementing those other activities and keeping COVID under control as much as possible, short of, and I think nobody would see it as palatable, going to a total lockdown as we've seen in some of the European countries. So it is that one where I think the situation will be continuously monitored. And I think one of the big advantages we have in BC is you literally have very much in time data, so that the decisions that are being made today are based on evidence that was collected tomorrow and provided and synthesized and put forward. So the one thing that I think we enjoy is the potential nimbleness in response to real-time data. And I think that's what's going to drive a lot of the decision making. If things certainly start going in the wrong direction, and I'm just going to pick on this as a theoretical example, that in terms of our long-term care facilities, it may be that some of this may need to be more sequential rather than being done all at once. That some of these things may have to be rolled back. On the other hand, it may be entirely successful and this drops off as a major source of concern in terms of infection given the high uptake. We may need to be focusing on schools. We're seeing Surrey being a center of focus. So part of this is so much being delivered on the basis of what we're seeing, what which of these areas involve the variant. A hotspot is certainly now looking like Vancouver Coastal, where they are seeing a significant upsurge in cases, and a lot of that associated with variants. How does that factor into the mix in terms of a provincial response? So I think this is a literally a day-by-day, hour-by-hour evolving situation, and we need to be able to respond to it in a fashion that's not only acceptable to the public, but also controls the virus.
As immunizations in community clinics are happening all over the island, seniors who are patients in hospitals are still waiting for their shot. I asked Victoria Schmid, Vice President of Pandemic Planning at Island Health, why they haven't been immunized yet.
I have a listener who has a 85-year-old family member in acute care in the Duncan Hospital. They have been there for about 9.5 weeks, and they're scheduled to be there for quite some time still, and they have not been immunized. So I'm kind of curious, why haven't vulnerable seniors in acute care been immunized yet?
Yeah, that's a really good question. And first of all, my condolences to your friend's family member who is in the hospital and remains there. And what I can let you know is that we're actively moving forward with immunizing those over 70 in acute care. We've started at Victoria General Hospital as well as Nanaimo Regional Hospital, and we'll be moving into the other hospitals. We're a little slower than we had planned just because our Moderna vaccine, which is what we use for outreach, has been delayed. But we anticipate being done in acute care in the next couple of weeks. And that covers all of our acute care facilities, anyone 70 and over in those acute care facilities over the next couple of weeks.
this week saw an outbreak at the Long Lake Chateau Independent Living Facility in Nanaimo, which had a vaccine uptake rate of 100%, but still saw 8 residents test positive for COVID-19. Dr. Stanwick says this shows while vaccines are highly effective, they are not a magic bullet.
In investigating, there was probably a couple of things happened. One, we have to remember that this vaccine is still, even after first dose, and again, a period of preferably 21 days, about 95% effective. So 1 in 20 people will not mount an immune response and still will be susceptible to the virus. I think the other thing that happened is that, and this is something that's a general caution that we've been putting out to the public, that people think that as they walk out the door from our vaccine clinic, they can go back to fraternizing and socializing and mingling and not following all the measures that Victoria has already identified in terms of the physical distancing, the masking, the washing of the hands, staying home if sick. And so what we may have seen, and this was certainly observed in Vancouver Coastal, that it may have been either one of two things, that somebody introduced it, and these early on when these people had not developed a full immune response, or somebody might have even been incubating the virus at the time that they received the vaccine. And that was documented in Vancouver Coastal, where they had 3 to 5% of the people who got their vaccines early early on in our vaccination program came down with virus, and people were saying, "Oh my gosh, the vaccine causes the COVID." When in fact, what happens is that we just didn't catch them early enough to be able to intervene with the vaccine. So we're really looking at, and this is, I think, probably one of the most important facets of the vaccine, even though if the vaccination wasn't perfect in terms of giving the full response so the people didn't develop any symptoms, what we are also monitoring for is to make sure that these people don't require hospitalization, or as we've seen in so many of the long-term care facilities, this is a lethal virus. And so if we can blunt the significant impacts on these people's outcomes having come in contact with the virus, the vaccine will still have worked. And so I think this is one of the rationale why I think Dr. Henry feels comfortable in moving at least some of the restrictions in terms of long-term care visiting, is that there is that interval in time that we should be seeing that high level of protection, and that the worst effects of the virus, even if it's acquired, are going to be much less significant than what we're seeing with the natural infection.
With almost 2,000 cases of COVID-19 in British Columbia identified so far as more transmissible variants of concern, Dr. Stanwick says people need to reduce their close contacts.
This is the biggest concern, is if it has higher rates of transmission, that means we're going to see more cases, which means our teams are going to be more stressed in making sure we follow those very effective but labor-intensive protocols that can control the virus. So, and of course, enlist the population in saying, look, we're dealing with the B117, the UK variant. We need you to isolate. I mean, it worked for the first 9 cases. We stopped them in their tracks with the good contact tracing and the people obliging us by doing the self-isolation and making sure that they didn't spread it further. And the good news is they all recovered at home. They didn't require hospitalization. That may not be the case in terms of this becomes the dominant strain. And again, our contact tracers being able to enlist that degree of cooperation and be able to do it in a timely fashion. I mean, this is the other thing. We want to get on top of this as quickly as possible so that we don't see individuals transmitting. And I think a number which we haven't thrown out, but during last year, for many months, the number of contacts per case was often just a 1-to-1 ratio, that one person had one real close contact. That number is 3 now. And so what we're really seeing, and this goes back to that age group question, that, we're seeing, certainly a younger age group, but we're also seeing that younger age group having more close, high-risk contacts. And so this is the other challenge in terms of getting it out there. So as we see the number of contacts go up at a time where there is a UK variant potentially coming and seeding the island, we're looking at what could be a much more challenging time for us going forward, knowing also that this is spring break, people have been traveling, and so we are bracing for a different time.
You're listening to Midcoast Morning on CHLY. That was Chief Medical Officer Dr. Richard Stanwick and Island Health's Vice President of Pandemic Planning, Victoria Schmid, speaking about COVID-19 on Vancouver Island.
You're listening to Midcoast Morning on CHLY. Do you have a business or nonprofit? Support local journalism by sponsoring Midcoast Morning. With nonprofit media, every dollar you spend goes back into our mission to support local journalism and local voices, not profit. Learn more about our very affordable rates by emailing sales@chly.ca. Up next, Mick Sweetman's interview of Logan Clifford on the rally in Courtenay today demanding action for missing and murdered Indigenous women in Canada.
Logan Clifford is the founder of Missing and Murdered Indigenous Women, Girls, and Two-Spirit People Takes Back Canada and is of Chippewa descent. She joins us from Courtenay, BC. Thank you for joining us this morning.
Bonjour, thank you.
Can you just tell us a bit about why you're calling on the government to address the issue of missing and murdered Indigenous women and girls at this time?
I believe that this has been a pressing issue lately, as well as the rest of the country is starting to realize how pressing this issue is, with BC holding the highest number of missing women across Canada, and Indigenous women always holding a higher percentage number of those women. So it is definitely right now, with our numbers growing with the pandemic, very urgent that the government listens and starts implementing promises that they have promised towards reconciliation.
So what motivated you to first get involved in this issue?
My family, all growing up, with us having an Indigenous background, we have been through many trials. I have lost my father to the medical system and not being listened to or heard. I've lost my grandmother to the medical system from not being listened to or heard. Other family members have endured horrific things. The local town that I'm from is very close to the Highway of Tears. So lots of family and friends have been personally affected, which alters our entire life growing up, living in these fears, as well as consistently having these healing journeys with our family as we're watching all of these situations unfold with all of our systems. So seeing how closely my family has had to endure everything from residential schools to my aunts and uncles being ripped out of their homes to having to heal from all of those situations that they were thrown into against their will, and living with those pains and seeing those pains and watching my family heal through them definitely had a huge strike in me to want to move this situation forward and really have everybody seen and heard so we can be safe.
Right. And like that must be very difficult to kind of deal with that generational trauma. How have you found this issue helps with that?
It does. The biggest thing about coming together, not only so other people can see the awareness, is a big way that we deal with things when we come together is community, talking, healing, sharing, drumming, singing, dancing. It's very much community events. So it helps us in our healing journeys as well as getting the word out. So that's a very special way that we like to deal with things when we do come together for this. So it's been helping so many community members. I've had people reach out all the way across the world, New Zealand, New York. There's way too many to list. And everybody's saying, just thank you for standing up. It is time for a voice. We need change now.
Earlier, you were telling me that you actually had a personal experience. You had to go to the RCMP. You mind telling our listeners about that?
Yes. So after I had moved here, I actually ended up enduring sexual assault through the medical system. And it was very hard. It was not something that you hear about in your everyday life, but it's not a lot that you hear about in systems. I know my family has suffered through things with systems their entire life, but when it actually happens to yourself, it's quite different. And I went to local police to report, and they agreed it was a sexual assault with a weapon, but it's not being pushed forward. Why is it not being pushed forward? I was told because of who the other person was, being doctor and a nurse. this can't be pushed forward unless the other person wants to participate in the investigation. That is not correct. That should not ever be told to anybody. If somebody is assaulted at the end of the day, that needs to be pushed forward. I've had to go through different avenues now to try to have local police pressured into looking into situations with no luck. I have had other people step forward locally. I'm going to leave them anonymous and say that they've endured similar situations or other abuse situations. And that's what really drove the need to have to start a bigger movement than what was just happening locally, realizing how embedded these racism is in all of our different systems, and how much when you go to look for help, there might not actually be the help you thought was there. And that's something a lot of our women and our people are enduring across the country. And it's been really hard on that level, just because, like I said, when you reach out, you expect these systems to be there in place to help us. And the more, with my own situation, and the more I advocate and have people step forward, we're realizing these systems are not here to help us.
That sounds incredibly difficult to deal with and go through. I really do empathize with that. Just for clarification, was that in Courtenay or was that your old hometown?
It is where I live currently. So it is right here in Courtenay that this happened.
From that personal experience, you start to get involved with this issue locally. Like, how did you first get involved in Courtenay?
I actually ended up just finding the girls on a website and asked if I could join their local rally. And at that time, I was pretty quiet. I was still dealing with my own traumas, but I wanted not my voice heard, but my family's voice heard at that time. And that's kind of what gave me strength to eventually stand up and tell my own story and be able to stand behind it. And when I realized how deep these systems went for not helping us, I realized I had to stand up and be a bigger voice, not just for myself, but make it a bigger picture, because it's not just me suffering with this. It's so many different people with these stories that we really need to stand up as a whole and say, we're done with this. We're done being treated this way, and we're done being statistics.
From that local activism, you formed a new national group. Why take it to the national level? Like, why not just keep organizing in Courtenay?
The more I have advocated with this, I'm realizing, so BC holds 27% of missing women across Canada, where Alberta's at 19%. The numbers are too high. This is not right. The more you look into any bill that's trying to be pushed forward for our equal rights right now, the government's not listening. Our women, our children, and our men are not going to be safe until the government listens. So we have to get bigger, we have to be noisier, and we have to put pressure until they listen, because there are people daily coming forward with stories, horrific stories. And this isn't right. We shouldn't be getting ignored. We shouldn't be just another statistic. We shouldn't be labeled as misadventure. We should be getting listened to and treated equally and getting equal justice when situations do arise.
Right. And you're specifically calling on Carolyn Bennett, who's the Minister of Crown Indigenous Relations, to implement I believe it's the 231 calls to justice from the inquiry into missing and murdered Indigenous women and girls. Is that correct?
Yes. So there are many groups that have actually done all of the work on this previously. There are many families involved. There are many survivors involved. And I'd like to thank all of them for having their strength to step forward. This is very important. This is 231 cases, many more family members involved. These cases are not being pushed forward for justice. This is one of many things that they need to push forward and show that we are going to have justice for our people, and show that we're not going to be overlooked. 231 cases is too many cases to sit on when Carolyn Bennett has the ability to move this forward. And it's just one of many bills that need to be moved forward now so our people can be safe.
It's been a year and a half since that final report was released. What have you seen the government do so far?
So far, we keep getting told that it's going to move forward. It has not. It is literally being sat on. We have had another letter go out in October from agencies trying to push forward the 231 calls for justice. At this point, we are being ignored and told they will move forward, but there has been no move forward. So literally, they're just sitting on this right now.
Now, obviously, in the last year, there's been the pandemic. Obviously, that's taken a lot of government attention. Do you feel that is a reasonable reason that things are being delayed, or do you feel that that's being used as an excuse?
I believe that they are very busy with the government right now, for sure. This is something that should have been taken care of before COVID. Too many of our issues for too many years now have been sat on. Most of these are many years in the making. They're not recent subjects. So they had more than enough time to be able to implement this before COVID, as well as being able to move forward on anything that involves implementing our rights. There are so many groups that have stepped forwards at this point, and everything comes down to us having our rights, being able to push forward as a people, and to be able to have reconciliation. And none of these individual things, such as 231 calls for justice, are actually being properly addressed or looked into. We just keep getting run around, and we're done with it.
Okay. What else would you like our listeners to know? Is there anything else that you think is important?
Yeah, the biggest message we want to give out, not only about our murdered and missing women, men, and children, is that to be able to fix this, we need all of our philosophies changed, all of our systems changed, so our people can be equal and safe now. When this happens, our people will now be seen and heard. Our safety will be taken into consideration much more. I'm going to quote a few things from the Treaty 8 chiefs on a conference they had. They said it perfectly. Reconciliation is back to undermining the First Nation people. This is not right. And when we finally get recognized as equals and pass through as equals, it's going to change everything from MMIW to all of the other problems that our people are enduring right now with all of the systems. Our core philosophies in these systems are very much taught on embedded racism level, which they are old ways to be taught. We need to implement new ways where everybody's included and everybody's equal, so everybody's safety can now be a top concern. We are done being statistics, and we need to move forward. And to be able to move forward, they need to be able to bring back, give us our rights so we can have reconciliation. There's no way to move forward until we have our rights back, whether it's MMIW or any other situation that us Indigenous people are trying to move forwards right now. Everything comes down to needing a change in all of these core systems. It's been too long with a system that's not working, and a system that is definitely undermining us as First Nation people.
And if people want to join the protests in Courtenay, how and when can they do that?
So Saturday at 12, your local time across Canada, just to make it nice and inclusive for everybody. Here in Courtenay, we have a rally at Sims Millennium Park. People are going to be bringing drums. We're going to be meeting in solidarity. People are bringing signs down just to bring awareness. So definitely come down at 12, or if you can't make it, you can go online and change your profile to red, post anything about MMIW or any kind of educational factor. We really just want the word and education out about what's happening to our women and our people, and be able to let them know different ways that they can help change this, such as writing Carolyn Bennett and asking for 231 calls for justice to be moved forward, or to be able to stand in solidarity at your own home, holding a sign in your driveway with your family. So there's so many ways to participate locally in Courtenay or at home if you're not able to make it out.
Okay, well, thank you very much for your time. Obviously, you're very passionate about the work that you do.
Thank you so much.
Thank you, Mick, for that interview of Logan Clifford from Missing and Murdered Indigenous Women, Girls and Two-Spirit People, Take Back Canada. You're listening to Midcoast Morning on CHLY. Delannah Gail Bowen is a member of Canada's Blues Hall of Fame and is the executive director for Vancouver's Downtown East Side Centre for the Arts. David P. Ball spoke with her about her new single, A Lullaby for Missing and Murdered Women, on Vancouver's co-op radio show, The Pulse.
Delannah, thank you so much for coming back on The Pulse. It's always wonderful to have you here.
You're welcome, dear. Thank you for having me.
The last time I actually ran into you was at the Missing Women's March, Women's Memorial March on February 14th. We've been a month since then. That's such an example to me every year of the other side of the narrative, of people coming together, of selfless behavior, of community. I mean, it was a particularly touching one because we saw the passing of the torch of the elder role. I mean, it's been a month, but I know, that's such an important event every year for countering these kind of selfish narratives we see.
It is. And, I was just talking about this the other day. I don't know if I should call it a tragedy, but the unfortunate part about this is, I was part of the original committee that created the march, and we fought for years and years to get the missing and murdered women's issue into the House of Commons and before the members of Parliament. So we finally did that. They did the Missing and Murdered Women's Inquiry. They made, I think it was 102 recommendations, but they haven't acted on it. So to me, it is still a major issue. And in fact, there was a young girl murdered just outside of Tinseltown. Nobody knows anything. Nobody's seen anything. So the thing about human rights and human issues is that we need to change our relationship with that. It's not another person's problem. It's all of our problems. It's a community problem. It's a social problem. It's mostly with women who live in poverty. And so the repercussions of this social platform where the people who live in poverty are not supported in various ways, whether it's proper housing, whether it's medical attention, whether it's the social climate in which they live, whether it's a healing process to encourage them to walk in a good way and live a healthy, productive life, is all taken away because of poverty. And so as long as this remains an us and them in terms of the ability to support oneself and provide for oneself in a good way and have proper housing that, somebody's not kicking down your door for drugs, which happens a lot in the SROs, or they're controlled by gangs in the SROs, we're going to have this problem. And nobody has the jam or the guts to say, hold it, and do a proper assessment, but then act on the assessment and the recommendations. I mean, what's the sense of doing a study for a whole year, spending $500,000 on the Missing and Murdered Women's Inquiry, and then not following up with the recommendations?
You wrote a lullaby for Missing and Murdered Women. Can you tell me a little bit about where this song came from, how it came to you?
Let me calm down for a minute. Well, most of my songs are songs that come through me. I don't sit down with the intention to write a song. However, I will say that the missing and murdered women have been on my mind for some time in a different way. Because of the families are recognized, but in my humble opinion, they are not provided with the necessary tools to put in their toolbox to address the loss of a child. And so what happens in some occasions, I'm not going to say this happens to all the families, but some have gone back to addiction, or there's abuse in the family. And I think that the other part of the equation, and it was one of the recommendations made by the federal government after the research and the interviews and all that they did as part of the inquiry, is they have not provided, what do I want to say, a tool that the families can use for their well-being, mental health. And so there are consequences from that.
You say in your write-up that the song acknowledges and offers comfort. What does that mean?
It means of thinking of any experience that you have had. It provides an opportunity to have a relationship with that experience in a different way. So by that I mean, instead of let me think about this for a minute. Instead of thinking of yourself as a victim and the person as a victim, they are physically, but we believe in indigenous practice, and I am a ceremonial woman, that when you pass, you go to what we call the other side camp. You go to the spirit world. And so there you are well and taken care of. We on the physical plane think of it as loss, and it is loss, but the person who has passed is fine. We hold on to our stuff. And so it can cause depression. It can cause a recession into, maybe you had abusive experiences when you were a child. Those things come back because you're holding on. And so the gift of that song is to remind people who have experienced loss is that the people that you're mourning, because you never lose the love. The people that you are mourning have moved on to the spirit world, and there it is a garden. There it is. There's lots of analogies, but you're in the light, so you're not unwell.
That's really powerful.
The challenge of that is, and we humans have a difficult time with this. It's acceptance. You accept what has happened, and that acceptance gives you some freedom to move forward with your life without holding on. Because when you lose, our society influences us to mourn, to think we've done something wrong. So you go into a guilt complex. There's all those negative things. And so in indigenous traditional practice, of course, we mourn the loss, but we know that what happens is to the person that has passed is they're all right, and they're surrounded by love, and they're full of light.
Because it's so difficult, and especially when it's unjust, when there's an injustice, it's the violence or the inexplainability of what has happened is just so devastating.
Yeah, agreed. Yeah.
Musically, it's been a very productive year for you. You've got this new song out. You also had your most recent album, Looking Back. Is there anything you've learned from this pandemic time as an artist, as a musician, and as an activist?
Okay, let's take it bit by bit. As an artist, because I have always thought, even before the pandemic started, that our world was running amok. People were running amok, and there was a great amount of selfishness and I'm right and you're wrong scenario with people and organizations, government. It's very divisive, this us and them climate. So my intention when it started, and the first thing was acceptance of the situation, but the biggest thing was that I am, very focused on my relationship with myself. How do I walk in this world? How do I talk? How do I think, etc.? Who am I and how do I be, so to speak? And it's given me the opportunity to reflect on things because I'm part of the Downtown Eastside Circle of Grandmothers, which shares teachings, traditional indigenous teachings and life practices to members of the community. However, what I think is the most important thing about this time is that we really look at ourselves and the relationship we have with ourselves, because it determines every exchange that we have. How do we feel about things? What is our attitudes, and are they positive? Do they serve us well? What do we have to get rid of that's judgmental, condescending, all those negative adjectives that can show up in our person in different situations and experiences? And if we're going to walk in a good way to influence the energy of Mother Earth and all living things, we need to be accountable to ourselves first about how we're walking on this earth, And so I think it's very important that people take the time to look at themselves and what are you judgmental about? What do you love? Can you invest more energy in that? Who do you criticize and why? So these are all things to make this a better world and allow people that maybe are having some problems to look at why they're having the problems. And, in your work, is your work who you are? Does it reflect your values? Does it reflect the way you feel about the human condition? And if not, take a good look at it and find out why you think that way. And if you can, change it. If you need to talk to somebody else to guide you, do that. But do the work to be the best person and human being that you can be.
I mean, it must be difficult not to be able to perform in the last year. And I know that blues is such an oral tradition and such a communal activity, not just a record that you listen to.
Well, yeah, it is difficult. But, at 75, I'm trying to pace myself and my health goes up and down. So I'm just grateful for what comes.
You're not touring with the Monkees anymore.
I'm not touring with the Monkees. But it's so funny that you should mention that. The Monkees were supposed to be in Vancouver. And the guy that was presenting it actually contacted me and asked me if I wanted to come to the show. Well, now it's been postponed 2 times, so I'm not quite. And quite frankly, I don't think, even though everybody's getting a vaccine, that things are going to open up to the degree that we can have a full-fledged concert anytime soon. So I'm not sure what's going to happen with that.
Do you remember when you first performed with them?
Oh, sure. The Winnipeg Arena. And I think I was 22.
Wow. What an amazing history.
I know. Who knew? I didn't even know who they were, to be honest, at the time. Listening to R&B, right? Not rock or rock music at that time, anyway.
Delannah Gail Bowen speaking about what last year has taught her as an artist and an activist on Vancouver Co-op radio show The Pulse.
And when she cried, as she grew by your side, these precious moments live on and on. The love's still there, we carry on. And now she's gone, her wings unfurled.
That's our show for today. I'm Mick Sweetman. Thank you for listening. Midcoast Morning is co-hosted and produced by Jesse Woodward with technical assistance from Arbie Frew. Thanks to David P. Ball from Vancouver's Co-op Radio for his report. Our theme music is Good Company from the Nanaimo band Venice.
Midcoast Morning is now up on Apple Podcasts and Google Podcasts. Give the show a boost by rating and reviewing it. Then share it with your friends online. Midcoast Morning is funded in part by the Community Radio Fund of Canada and Heritage Canada's Local Journalism Initiative. As this round of funding ends at the end of the month, we will be taking a short break, but hope to be back later this spring. If you would like to support CHLY's news department, you can make a donation on our website at chly.ca/